everybody, I'm Ariana. Welcome back to my channel. Today I am on my way to a appointment that I've been needing to get into for about a month. So I'll kind of get into it and explain to you guys why. So first things first, I have varicose veins in my legs, and there's two that bother me really bad. I mean, I wouldn't say really bad, but occasionally if I'm like on my feet for too long or if I'm sitting for too long, they start feeling like tender, if that makes sense. And they're like on the inner part of my knee where it bends. And so I went to the doctor to go get it looked at because I didn't know if anything was wrong, because I was starting to feel them and I had never felt them before, if that makes sense. And so I went to the clinic, I had a checkup, and they said, oh, it's completely normal to feel little tenderness and pain with varicose veins because essentially those veins are broken and you don't have any valves in them to keep the blood from, you know, not going back down. But my valves are broken, and a lot of my veins on my legs, I have a lot of varicose veins, and like some spider veins, whatever, but so I ended up scheduling an appointment with a specialist, and I went and seen him for a free consultation about a month ago, I would say. It was a few weeks ago. And he was really, really nice, and he does a lot of treatments for varicose veins for a lot of people. He said his youngest patient was 13 years old, so that's crazy that somebody that young has to deal with varicose veins. But he said that the factors of varicose veins are genetic, or a lot of females get varicose veins because apparently when you get your menstrual cycle, somehow it just like, it can cause varicose veins more than if you're not on your menstrual cycle, or like if you aren't going through puberty, I guess. I don't know how to explain it. He's definitely way better at explaining than I am, but yeah, so I am on my way to my ultrasound appointment. So it's going to be a 2-hour long appointment, and basically he's going to do, I don't remember what he said what's going to happen today, but it's a 2-hour long appointment, and basically we're just going to get a map of all of my veining and see what veins would need to be, you know, fixed, because I have, if I'm sitting for too long, I have my 2 varicose veins that like feel tender, but then I also get this like weird pain on my right thigh. And I wouldn't really say it's a pain, it kind of just feels more like you push on the inner thigh a little bit. I don't know if that makes sense. I don't know. It's very hard to explain because it's something that I've never felt before, but I don't know. It's honestly like really scary. I'm really nervous to get the treatment done because the highest risk factors are blood clotting, which he said, because I asked him straight up at the appointment, I'm like, have you ever had any clients who have ever had blood clotting? And he said no. He said knock on wood. And then he said that you could get like a lot of bruising, which I'm fine with bruising. And then he said that there's also this thing where, because essentially what they're going to do for the treatment is they're going to cauterize that vein shut. So they're going to take this little thread and they're going to go into your vein and slowly pull the thread out, and it's going to be cauterizing the vein as it comes out. So that's what the treatment is. And basically he said that when the vein is getting cauterized, sometimes liquid blood will get trapped in there and it'll feel like a hard lump, kind of like a blood clot, but he said it's not like harmful, I don't think. And he said that basically it would go away on its own eventually, but if you wanted to, you could come back and he could drain that for you. I'm getting sick to my stomach just thinking about it, because it like, it stresses me out and it scares me because like it's life-threatening, especially if you end up with like deep vein thrombosis and like all that stuff. Like I've been researching, and like of course I shouldn't research on Google because that'll always tell you stuff that isn't true or whatever, and I've like been really stressed about it. It's what's on my mind 24/7. And I know he said the youngest girl was 13 and had to deal with like varicose veins and stuff, but for me I just feel like it's definitely because of my weight gain. I had asked him, I was like, oh, like, do you think it's from like me gaining a lot of weight? And he's like, no. He's like, I don't think so. He said that he thinks it's from like hereditary and like in my genes, whatever. But like, I don't know, I feel like it's from me gaining a lot of weight because I never had any until I started gaining a lot of weight. And I feel really stupid for letting my body get this far and get this out of hand. I mean, I'm constantly worried about my health, and I'm like only doing it to myself, but it's just so hard because like people who are addicted to like drugs per se, when you're addicted to drugs, you're not thinking about the after effects or like the addiction. You're just thinking about like how it makes you feel. And that's exactly how it is for me and food. Like, I literally love food, and I eat meals to make me happy, and I eat meals to comfort me, and I eat snacks and desserts, and like I drink a lot of soda. Like, I'm only doing it to myself, but it's kind of like a drug when you have, I guess I would call it an eating disorder, and it's just really hard. Especially when stuff like that, you know, helps you with your emotions, and it's kind of like your friend in that moment when you need someone, if that makes sense. And food just brings me so much comfort, and over the last few years I've gained a lot of weight, and I know people can tell, I know people know that, and I know that. I see it every single day. I know what my body looks like, and it just upsets me that I let my body get this far. But anyways, I am here, so I'm gonna pull in. Oops, sorry for the bum. I'm gonna pull in and go in, and then I will try and videotape some stuff. If I'm able to, I'll have to ask him if it's okay. But anyways, I will see you guys in there. Okay guys, so I got done with my ultrasound appointment, and we actually had to cut it short, and I'll explain to you why. But I did just go to Noodles and Company to get Brian and I some dinner. He's at work right now, so he's gonna wait till he gets home, but I'm gonna eat mine once I get home. And then I also stopped and got myself a matcha frappe from Starbucks. But let's get into how my appointment went. So I didn't film anything because I had to stand on this like stairwell area, and you'll see that in the clip that I'll insert. But so basically what happened was I was standing up, and you know, he was squeezing my legs and doing the ultrasound and looking at my varicose veins and just doing like a map of my veins, I guess. And the whole time he was squeezing, like I don't know why, well I know why now, but I started getting really nauseous, and I kept like salivating a lot, and I kept like getting that like sour feeling in my mouth, like you were gonna throw up. But I don't throw up. If you guys know me, you know I don't throw up, so I wasn't going to, but I just felt like I was going to. And I started sweating, like I was dripping sweat, and I started getting kind of dizzy, and my legs felt really shaky. Like I just felt really weird. And so I told him, I was like, oh, like I'm really hot and sweaty, you know, and I was feeling nauseous, but I didn't want to tell him I was feeling nauseous because I thought it was just from my anxiety. And so, you know, we get done with my left leg, and then he's getting started on my right leg, and my left leg took 1 hour. So then the right leg was going to take an hour, you know. And he goes, oh, like, are you okay? And I'm like, yeah, I'm fine, you know, because I, again, thought that the nauseous feeling was from my anxiety because I felt nauseous going in. And he goes, oh, you know, okay. He's like, well, continue going. And I'm like, okay. So then, you know, he asked me a couple times if I want to take a break, and I'm like, no, I'm okay. Well, then, like, as we're going, I'm like, I just start feeling, like, worse and worse and worse. Like, I'm not feeling any better. It's getting worse. I'm sweating more. And he turned a fan on for me that he had in the room, and I just kept feeling, like, worse and worse, right? So, sorry, I'm trying to pay attention because I just went around a roundabout. But anyways, so we're trying to, you know, do my other leg, and like I said, I was just sweating more and more. He turned a fan on for me, and he handed me my water bottle because I had brought no water with me. And I was like, okay, I'm like, you know what? I'm like, I think I should take a break. And he's like, okay. It's like, that's fine. He's like, you can sit down. And then when I sat down, I started feeling a little bit better after I was taking sips of water. And he goes, yeah, he's like, I think we should just, you know, reschedule if it's okay with you. He's like, you know, he's like, a lot of patients have that happen to them where they end up fainting because, you know, pushing on your varicose veins, that's moving your blood around, and it's like pushing on your varicose veins. And, you know, he's like, a lot of people have their heart rate drop really low, and then their blood pressure gets really low. And he's like, I don't want you to like faint or anything. He's like, I want you to be okay. He's like, so let's just pause it for now, and, you know, we'll do it again, you you know, next time you come in. I'm like, okay. So I rescheduled, and my next appointment's in May, which kind of sucks because that's kind of far away. But at the same time, I mean, I guess it's a good thing that we had to reschedule because obviously I don't want to faint. And I've never fainted in my life before, so that's not something that I wanted to do today. But yeah, when he told me that, I was like, okay. I'm like, thankfully I'm not the only one that has ever felt this way, because he told me that he's had other patients faint before and that he didn't want that to happen to me. And he said, thankfully, like, I told him how I felt, because a lot of people don't tell him and then they just end up passing out. So I'm glad I said something to him, because I was like, oh, it was bad. I felt like I had the cold sweats and I felt really nauseous, and I'm glad I said something to him because I have never fainted before and I would not have known what that would feel like. So I'm glad I said something, but it kind of sucks because I still have 2 months now until I can go back again to do the next leg. So that's something I have to wait for, but I just wanted to explain that to you guys. Whoa, that car scared me. But yeah, so anyways, about Noodles and Company, I got a hack, because I don't know if you guys know, but they used to have steak stroganoff and they don't have that anymore. So I ended up getting a hack that I saw on TikTok where you can order something that's like the steak stroganoff, but I guess even better. So I ended up getting that, and then I got myself those pot stickers, because their pot stickers are so good. So I got that. So now I'm gonna head home, and I think I'm gonna go to my mom's house so I can go see the boys, ham and bacon, and then I'm gonna go tell her the story about what happened today. But yeah, thank you guys for coming along with me. I was gonna film, but I mean, again, I was standing up straight, and I'm glad I didn't, because I just felt really sick, and I feel better now. I'm still kind of nauseous, only because, again, I'm very anxious, but I'm glad everything went good and I didn't pass out, because that would have been really scary. And yeah, but I did ask about the treatment that I have to do, and he said that Brian can't be in the room with me, so that kind of sucks. But I think I'm still gonna have Brian come with me, because it is something scary and I don't really want to be alone for it. He said it's really quick, so if anything, we can just go back to work right after, whatever Brian can, you know. I took the whole day off today because I just kind of wanted to, you know, because a 2-hour appointment, standing up for 2 hours is what I thought. I didn't want to have to go back to work right after, and, you know, I wanted to be able to enjoy my day off. So I'm going to go hang out with my mom and talk to her about my appointment, and then eat my dinner, and then I'll probably clean up the house and just do some normal housework stuff. I got to do my laundry because I forgot to switch it to the dryer. So I have to switch it to the dryer and dry my clothes, and I have to put those away. So I'm kind of glad that I took the whole day off. So I'll get some chores done around the house, and yeah, so I will see you guys in a little bit. I will hopefully remember to vlog. If I don't, then I'll just film an outro later. But anyways, yeah, I will see you guys soon, and I will show you guys my food if I remember, so because it's gonna look bussin'. I haven't looked at it yet, but yeah. Bakes.
Looking back, he never could have imagined what would...
Hi guys, so I am back at home. I hung out with my mom for a couple hours and we just watched some TV and just talked. And then we went to the store and I got a couple things. I just got like gum and some shampoo and conditioner. That's pretty much it. And I ate my Noodles and Company. It was really good. I forgot to show you guys a video of it, but I ended up grabbing my food and going straight to my mom's because I wanted to tell her about me almost passing out at my appointment today. But I think I'm going to do my laundry and put it away because, like I said, I have to switch it over to the dryer and dry it, and then I have to put it away. So I think for right now, I'm just going to watch some TV and just relax for a little bit. And yeah, that's pretty much it. So I will keep you guys updated if anything happens, but as of right now, I'm just going to chill. So I just made a separate video of me waving my hair. So if you guys are interested in watching that, I will probably be posting it after this video. So go over and check it out, but I like it. I think it turned out really, really cute. It looks like whenever I braid my hair and I crimp it, but it just looks like a bigger, more natural crimp, if that makes sense. It flows really well together and I really like it. This is the other side of my hair. I couldn't do this side of my hair as well as the other one because I'm right-handed. So my left side of my head was easier for me, but this is what it looks like. I actually really like it. It's cute. I will definitely be doing that again for when I go out sometime, but I like it. It looks really cute. My hair looks really healthy and shiny. So yeah, I really like it, but I think I'm just going to end the vlog here. I don't really have any other plans tonight besides putting away laundry and probably playing some games, watching TV. So I just wanted to say thank you so much for watching this vlog. If you guys have any questions about my varicose vein treatment, comment down below and let me know. But I look forward to seeing you guys soon. And also, I'm hoping that everything goes good and I recover really quickly. And it's not like a full-on surgery, but I explained to you already what happens. But if you guys have any questions, comment down below. And yeah, thank you guys so much for watching. Bye.